CBC stands for Complete Blood Count. As the name shows, complete count of blood. It is very common and initial test of laboratory world for the detection of every disorder, disease or syndrome affecting the human body. Any kind of disease or condition affects the body organs and tissues through blood, which is a connective tissue in the body with a lot of vital functions, including transportation of oxygen and nutrients, filtration of body waste, regulating body temperature and many others. Now let's talk about its principle. It works on the principle of flow cytometry, which means that blood flows through the chamber and light falls on it, which makes the measurement of blood cells possible. Now the question is, what can be showed in CBC? So CBC basically help us to identify about the quantity of blood cells and other products in the blood. For example, red blood cells, which plays a role in the transportation of oxygen, white blood cells, which helps in the immune system of our body, which are further divided into granulocytes and agranulocytes. Granulocytes includes neutrophils, basophils, and xenophils, and agranulocytes are monocytes and lymphocytes. Platelets, which sustain the body's natural mechanism of clotting. Hemoglobin, which is a carrier of oxygen in the RBCs. MCV, which stands for mean cell volume. HCT means hematocrit, which is an average volume of RBCs in percentage form. MCH, which is an acronym for mean cell hemoglobin, and MCHC, which means mean cell hemoglobin concentration. Then at last we have MPV in CBC, which stands for mean platelets volume. CBC test is done in 3 different types of analyzers, which are classified as 3 parts, 5 parts, and 7 parts. The analyzer consists of 3 parts, tell us only about the quantity of blood cells, lacking the specialty of showing granulocytes and agranulocytes. Analyzer having 5 parts is deprived of showing the quantity of reticulocytes in the blood, which are immature red blood cells, whereas third analyzer detects all the parameters related to the blood cells. The test is actually performed with the sample of whole blood, which is taken following standard operating procedures. It is considered good to shake the blood while moving the sampling tube before testing, because blood becomes mixed good by doing so. But the speedy shaking results in the breakdown of red blood cells present in the sample. Now let's talk about its procedure. Take the blood sample of the patient in an anticoagulated EDTA purple top tube. EDTA is an anticoagulant, ethyl diamine tetraacetic acid. Then mix the sample tube up and down or put it on roller for 2 to 3 minutes. Then aspirate the sample to analyzer and wait for the results. Now the question is, what happens inside the CBC analyzer? In fact, the analyzer consists of 3 main systems. First one is flow system. In this, blood we aspirate to analyzer passes through the chamber. At a time, only one blood cell is allowed to pass within the chamber. Number 2, optical system, in which from a laser light falls on the blood cells passing through the chamber and reflects towards the detectors. The 2 detectors are arranged in forward and side manner. The forward detection of light tells us about the cell size and refractive index, etc. And the light, which is detected at 90 degrees to the axis of laser path, help us to tell about the granules and inclusions found in the cells. Then we have electrical system inside the CBC analyzer. These emitted lights are then converted into digitized values, which are stored in a file for analysis. So that's all about a common and initial laboratory test, complete blood count, that how it is performed and what is the principle on which it works.